The ferry had been delayed by 3 hours, and by the time it finally docked, the sky had gone that particular shade of gray that can't decide if it wants to rain or just threaten to. I was sitting on a wooden bench near the loading ramp, with my travel bag between my feet and a cup of coffee that had stopped being warm somewhere around hour 2. I wasn't working. I wasn't on call. I was, for the first time in what felt like several lifetimes, just a person waiting for a boat. That's when the man sat down next to me. He didn't say anything at first. He just set down his backpack, one of those enormous hiking ones that suggests either serious ambition or a deep misunderstanding of what a weekend trip involves, and exhaled like someone who had been holding their breath since morning. He was somewhere in his mid-30s maybe, dark jacket, good boots, the kind of jaw that looks like it was designed by someone who took their time. And his hands, when he pressed them flat against his knees, were shaking. Not violently, just that fine, constant tremor that most people wouldn't notice. I noticed. I didn't say anything either. I just watched, the way you do when you've spent enough years in medical settings that your eyes start doing their own quiet triage without asking permission. His color was fine. He was breathing evenly. Not a cardiac event, not a panic attack. His breathing was too controlled for that. He was just unwell in some ordinary, manageable way that he was clearly trying very hard to manage. He caught me looking, which was fair. I had been looking. "Sorry," he said. "I'm not contagious." "I didn't think you were," I said. "I was just noticing your hands." He looked down at them like he'd forgotten they were attached to him. "Yeah, low blood sugar probably. I skipped lunch. And breakfast. And possibly dinner last night now that I think about it." I reached into my bag. I always have snacks. This is not a personality quirk. It is a medical necessity that I have projected onto my entire life. I handed him a small packet of peanut butter crackers without ceremony. He looked at them, then at me. "You just carry these?" "I carry a lot of things," I said. "Eat the crackers." He ate the crackers. We sat in companionable silence for a moment, watching a seagull make a series of increasingly poor decisions near someone's unattended sandwich. "I'm Marcus," he said eventually. "I'm the person who gave you crackers," I said. Then, because that was a little mean, "Sophia." He smiled. It was a good smile, the kind that arrives slowly, like it's checking first to make sure the situation deserves it. "Are you a doctor?" "Nurse practitioner," I said. Close enough that the joke still works, not quite close enough that I have to pretend I enjoy paperwork. He laughed at that, a real laugh. The tremor in his hands had already settled. Blood sugar responding, the way it does when you give it something to work with. That's the thing about hypoglycemia. It sounds dramatic, and it can be. But in its mild forms, it responds beautifully to something as simple as a handful of crackers and a few minutes of sitting still. The body is remarkably forgiving when you give it half a chance. "I've been traveling for about 2 weeks," he said. "I think I've been not great at taking care of myself." That's a very polite way to put it. I'm a very polite person. "You're a person who skipped 3 meals and is now shaking on a ferry dock," I said, but gently. "Those things can coexist." He looked out at the water. "I'm supposed to give myself an injection tonight. I've been putting it off. I hate it. I've been doing it for 2 years, and I still hate it." I turned to look at him more fully. "What kind?" "Vitamin B12. I have pernicious anemia. My body just doesn't absorb it the way it should, so I have to inject it directly." He said this with the particular flatness of someone who has explained it many times and still finds it slightly absurd. "I know it's not a big deal. I know it's just a small needle. He stopped. "I just really hate it." Where do you inject? I asked. Outer thigh, usually. My doctor showed me once, and then I was just supposed to know. I nodded slowly. Do you have everything with you? In the bag, yes. I've been carrying it around for 4 days. I looked at him. He looked at me. The ferry horn sounded somewhere in the distance, which felt like the universe offering a dramatic pause. When we board, I said, find me. I'll walk you through it. We found a quiet corner of the passenger deck, one of those nooks near a window where the light was low and the hum of the engine was just loud enough to feel private. He had everything laid out on the little fold-down tray with the careful organization of someone who is anxious and trying to compensate with neatness. The vial, the syringe, the alcohol swabs, a small adhesive bandage still in its wrapper. Okay, I said. I kept my voice the way I keep it with nervous patients. Unhurried, like we have all the time in the world, like this is a conversation and not a procedure. First thing, you've been tensing up every time you think about this, which means your muscle is already braced before the needle even gets close. That's the thing that makes it hurt. He looked at me. So how do I stop tensing up? You don't fight it, I said. You just redirect. Pick something to look at. Out the window. See that lighthouse? Look at that, not at your leg. He looked at the lighthouse. I watched his shoulders drop about 1/2 inch. Good. Now, outer thigh is a smart choice. You've got the vastus lateralis there, which is a large muscle, good tissue depth, and you can reach it easily yourself. About a hand's width down from the hip and a hand's width in from the outside. That whole middle section is your zone. I touched the outside of my own thigh briefly, just to show him the area. Clinical gesture. He nodded. Before you inject, you want to clean the site. Alcohol swab, let it dry for a few seconds. Not just a quick wipe, let it actually dry. Wet alcohol on a fresh puncture stings more than it needs to. I always just went straight in, he said, with the expression of someone understanding retroactively why something hurt. That explains a lot, I said, not unkindly. Then, and this is the part most people rush, you pinch up a little skin if you have less tissue depth, but on the thigh, usually you don't need to. You insert at about a 90-degree angle, straight in, confident, smooth. The hesitation is what makes it worse. A slow, uncertain needle is more uncomfortable than a decisive one. Confident, he repeated, like he was committing it to memory. Like you mean it, not aggressive, just intentional. I paused. Think of it less like stabbing yourself and more like knocking on a door. You knock with purpose. You don't scratch at it uncertainly. He laughed at that. Knocking on a door. Okay. Once you're in, aspirate slightly if you were taught to, though current guidelines for intramuscular injections have moved away from that for most cases, so don't stress if you skip it. Then inject slowly, not rushing. Give the tissue time to receive it. Then withdraw at the same angle you went in, press gently with the swab, and you're done. He was quiet for a moment. The lighthouse was still out there, doing its slow, patient rotation. Will you stay? He asked. While I do it? You don't have to touch anything. I'll stay, I said. He did it. Not perfectly. His hand hesitated for just a 1/2 second before insertion, which I noticed and said nothing about, but he did it. The needle went in, the medication followed, the needle came out. He pressed the swab to his thigh and exhaled in a long, slow stream. That's it, he said. That's it, I said. He looked at the tiny adhesive bandage in his hand like it was evidence of something. I've been dreading that for 4 days. I know,